there was 0 newly added confirmed case in Beijing. And we have discharged 13 patients from the hospital. Ever since the outbreak of the incident in Xinfadi wholesale market, the number of cumulative confirmed cases in Beijing amounted to 335. 307 are still in hospitals, and 28 are discharged from hospitals. 31 are the asymptomatic carriers still under observation. And according to the State Council's small applet on WeChat, on July the 7th, in Xicheng District, the Beizhifang neighborhood and the Yongdinglu neighborhood in Haidian District have lowered their level of risks from mid-risk to the low-risk districts. By 3 o'clock in the afternoon of July the 7th, we still have one remaining high-risk area in Beijing. In 8 consecutive days since the new outbreak, we have kept the newly added confirmed cases within one-digit number, and there have been 0 newly added confirmed cases in Beijing for 2 days in a row. And we also have broken the record in terms of the number of discharged patients from the hospitals. In Xicheng District, we have now 0 mid-risk area. So the capital city is really looking up in terms of the epidemic situation. It's now under our control and within our expectation. The results are hard-won, and we have to treasure the current achievements and keep up such good work with a calm mind. After all, 0 newly added case doesn't equalize 0 risk. We have to look at the big picture and still stay alert about the transmission possibilities and keep averting the imported virus and the transmission of local situation. So we also have to fill in the loophole with every party shouldering their due responsibilities with prevention and control measures in place, and we must orderly accelerate the process of self-control of the epidemic. We have to work on both ends of a resumption of production and resumption of work. We are now entering a new normal situation, and we have a quick screening treatment to effectively cut the transmission channel of this virus. And at the same time, we must speed up the process of work and production resumption. We have to take practical measures to implement the certain 5 measures and try to cultivate new forms of businesses and new economic drivers. We also have to guarantee the targeted services to enterprises to handle the real concerns of those businesses. We must also be people-oriented to work on 6 stabilization policies and 6 guarantee measures. With such people's livelihood put in priority, we could focus more on the vulnerable groups. For example, the graduation of those high learning institutions and their employment issues. We must ensure to hit the target of poverty alleviation to build a moderately prosperous society in an all-round way. Everyone must be the guardian of their own health. Every person must shoulder their due responsibility. We must all report any rumors and try to get confirmed information to curb the spreading of rumors and avoid its intervention in our overall epidemic control and prevention efforts. Now, we have invited several experts to attend this press conference, and I would like to present them to you. Madam Pang Xinhuo from Beijing CDC, from the Peking Union Medical University, Wu Zunyou, and from the third affiliated hospital of Peking University, Mr. Fu Wei. Dear media friends, good afternoon.
北京北水嘉伦市等餐饮单位聚集性感染疫情。此外，同时涉及单位、家庭、公共场所、市场等2个及以上场所的混合型聚集性疫情6起58人，如大兴区孙村乡慈卫路1号疫情、面面居道餐厅疫情等，除在单位内部造成了病例聚集外，还同时引起了家庭内传播。目前，我市有高风险街乡1个，为丰台区花乡；中风险，其中大兴区8个，丰台。
We must avoid any gathering for any small talks between the neighbors. And some people have lowered their vigilance about this epidemic and try to gather with their family and friends. So they have been taught the lesson about a rebound of the epidemic. The lesson told us that we have to keep up the results of epidemic control. After all, 0 new added case doesn't equalize 0 risk. From infection to the symptoms occurrence, there have different complications about the epidemic. Some of them may not be very obvious, but they have very strong capability of transmission. So we must be committed to sorts of epidemic control measures and stay alert and abide by the self-protective measures and the sanitation measures. If you have to go out, you must wear your facial masks. And in the public spaces or closed spaces or any place with potential hazard, please wear your masks and keep a distance from others. We must wash our hands frequently and manage all family members in your household. If any family member has any symptom or discomfort, please report voluntarily to the hospital. And we must coordinate with the epidemiology studies to avoid any mentality about being immune from the infection. We cannot share our kitchen utensils with the other family members, for example, chopsticks. to avoid the transmission of the virus between family members. For the tertiary industries and the public spaces, we must continue such body temperature checks and disinfection of the spaces. We must keep the flow of population in those public spaces under control and take effective measures to avoid any gathering. All industries and neighborhoods and entities must take targeted measures about the risks of the transmission and fill in the loophole and implement those control measures in real sense. Dear civilians, the epidemic control requires consistent efforts in order to have the final victory. So work and production resumption, the market recovery will have a safer environment. We must consolidate the hard-won results and implement our responsibilities about epidemic control and prevention. Thank you, Madam Pang Xinhuo from Beijing CDC. Next, let's give the microphone to Deputy Director General of Beijing Municipal Public Security Bureau, Pan Xuhong, to brief us about the penalties of those rumors. Dear media friends, good afternoon. Since June the 28th, the coronavirus confirmed cases have kept its increase under one-digit number. Particularly in those recent 2 days, we have 0 newly added confirmed case. So those results are hardly won, but there are still those ill-intentioned people spreading out rumors, while all the civilians have been working hard shoulder by shoulder to fight against the virus. They are trying to interfere with the overall picture of epidemic control, and the Public Security Bureau in Beijing have been very stringent on cracking down upon those rumors. Since June the 11th, we have in total taken 92 such cases and have taken 113 people in custody who have broken the law. There are rumors like the first case may have come from a different source, and the expressways have been forbidden to be sent to Beijing. For example, a female at 29 years old, when she was staying at home, she felt bored. So she made rumors out of nowhere. And for one confirmed case in Daxing district, she had accused that case and spread out the rumors about that person, leading to very bad consequence. And now she has been taken in custody criminally by the Daxing People's Court. And as to the speed up of the nucleic acid testing and the positive result, there are some rumors about the case. For example, building the hospital in Chaoyang district. In total, for those scenarios, we have taken 14 cases about those rumors. And also recently, according to the complaints of the netizens, some people have been spreading rumors in WeChat. For example, concerning the transfer of payments. And according to the Public Security Bureau, the person responsible for the rumor is located in Xiangcheng of Henan province. So Xiangcheng Public Security Bureau has taken charge of this case. And finally, we discovered that a 51-year-old Mr. Ma has been making this rumor and spreading it out. And he has been taken in custody by the Xiangcheng Public Security Bureau. Another rumor is about the tens of thousands of people in Xinfadi have been transferred to Dengshikou of Tangshan. And also another rumor is about one confirmed case in Lianjia Real Estate Agency. Those comments and rumors stand in a number of 32. They were made in order to stir panic among the general public. Another rumor is about the newly added 23 cases in Meigaomei. and the supermarkets have been frequented by those positive cases in Fengtai district. Those rumors successfully caused a panic among the general public. A 58-year-old female, Madame Yu, has been making those rumors out of nowhere, and that female has been taken in custody criminally by Fengtai People's Court and Public Security Bureau. For the other hospital-related cases, the number stood at 26. So after 1 month of testing of the time, the whole city's epidemic control and measures proved to be effective, and the situation is stabilizing. But we still have to stay calm-headed that the cutting of those rumors spreading is paramount. After all, those rumors may lead to panic among the general public or even the losses of their properties of the civilians. So we have to talk about the personal responsibilities and to build a firewall of rumor spreading. In front of those rumors, our general public must be clear about them and try to not spread them out. And we have zero tolerance about those rumors. We will crack down upon those behaviors of making and spreading rumors according to the law to safeguard the results of epidemic control. Thank you. Thank you, Mr. Pan Xihong from Beijing Public Security Bureau. Next, let's give the floor to the head of Third Affiliated Hospital of Beijing University, Mr. Fu Wei, to brief us about emergency care in the hospital. Dear media friends, good afternoon. On behalf of the Third Affiliated Hospital of Peking University, I am now reporting to you the emergency response measures during the epidemic control period. Ever since the outbreak, our hospital has been implementing the policies of the leading group of Beijing Epidemic Control and Prevention. We have been practicing the requirements. We have 3 prevention measures and 9 stringent policies in place. Our staff members have been working hard to conquer the difficulties. We also assisted the Wuhan frontline with proper treatment policies in place locally. We also have the emergency response measures to save those people in urgent needs. Up until July the 5th, we have accepted 81,644 patients, including 3,432 pregnant women. We have completed 1,449 operations. All the staff members and the patients being rescued have zero infection ever since. We also have deepened our system building to proceed with the emergency response measures. We have timely built our panel group led by the main people in charge of the hospital to guide us in the prevention and control measures implementation. The whole procedure of rescue have been implemented, so treatment and emergency response have been handled properly. The infection respiratory divisions, the imaging division, and experts from the virus infection arena have built their panel of experts to help us with the diagnosis, treatment, and screening of the coronavirus. The director of the Department of Emergency Rooms also taken the lead in touring around the wards and giving the treatment policies of emergency response. We have sped up the referral of those patients to avoid any possibility of those patients in emergency rooms to spread out the coronavirus. The pregnant women have been putting priority in coronavirus prevention and control. We built our capacity in helping the vulnerable groups like the pregnant women with our green channel in place. We have improved our contingency plans in helping the pregnant women. For example, we have doubled the beds for pregnant women. And with enough personnel resources in place, we can guarantee orderly inpatients of those pregnant women. And as to the division of obstetrics, we have a special section set aside for those kids with infection possibilities. For those with epidemiology history, we have quarantined those children to avoid any further infection transmission. So we have added more rooms for the kids in obstetrics divisions to get screened for the infection. And every day, we can accept over 2,000 people for nucleic acid testing. So with enough resources, we can guarantee the timely screening of those dangerous cases and cases under severe risks. Secondly, we have worked on the details in the emergency response. Medical services and the epidemic control have been put same importance. We have consistently trained 56,000 people, and we have controlled the entrance and exits of the hospitals with the Jiankang QR code. And for different entrances, we have usually 2 times of body temperature checks and disinfection. Throughout the whole hospital, we will have monitoring regularly. If we discover any hazard, we will put them on records and ask for immediate checks and correction. As to those hospitalized patients and their family members, we also take their body temperature, and their nucleic acid testing will also be arranged. So for those visits, we have stringent measures. If not necessary, we do not allow them to stay with the patients in the wards. For the operation rooms, the wards, we try our best to reduce the density of population. According to the requirements of the fever department, we strengthen the desegregation of the different sections to manage stringently those wards to avoid any further transmission of the virus in the hospital. And for the staff members working in the fever section, we will order the takeaway food to them. Thirdly, we build our consensus among experts to boost our capacity of emergency response. For example, in the front line of Wuhan, and we have been cooperating with those experts in the front line. After all, they have accumulated enough experience in practice, and we have also compiled 3 pamphlets about epidemic prevention and control to shoulder our social responsibility. Mr. Qiao, the president of the hospital, also was invited to deliver a speech about the mother-to-child transmission of the virus. In some medical journals, we have also published papers about the pregnant women and the children's prevention and control of the coronavirus in order to share with the international friends about China's experience. On the Science and Technology Day at national level this year, we have won the award of epidemic control and prevention. For the next step, according to the National Health Commission and the leading group of Beijing Epidemic Control and Prevention, we will stay committed to working on both medical services as usual and the epidemic control and prevention in order to win this battle. Thank you. Thank you, Deputy President of the Third Affiliated Hospital of Peking University, Mr. Fu Wei. Next, let's give the floor to Wen Ming from the Peking Union University Medical College to give us more information. Good afternoon, dear media friends. On behalf of the Peking Union Medical Hospital, I would love to brief you about the updates of the sampling and nucleic acid testing. The nucleic acid testing is an effective method. It requires the capacity building in sampling and testing. Ever since the new outbreak, our hospital has built an expert team to make decisions about prevention and control measures. So on one hand, we work on boosting the prevention and control of the epidemic, and on the other, we guarantee enough medical resources for the usual hospitalization. So we have highlighted the responsibility senses to the society, and within 70 hours, we have built 200 square meters of nucleic acid testing place, and that team of nucleic acid testing has a number of 203 people, and within 58 hours, we have built our laboratory for nucleic acid testing, and we have increased the number of nucleic acid tests to about 10,000 at the same time. So we could guarantee the safety and health of the staff members, of the medics, and the patients. On June the 18th, the contracted laborers and the full-time employees of our hospital has completed nucleic acid tests for 10,000 people. So this newly built nucleic acid testing place has fully conformed to the requirements of nucleic acid testing. So registration, sampling, and testing have been put in the same place. That is convenient for the patients. We have 7 groups with lavatories and also sampling rooms and testing rooms. So it is separated from the fever department. In that way, we can avoid cross-infection, and we can take about 4,000 such tests per day. And according to the requirement of Beijing Leading Group, on July the 28th, we have built a team of 203 experts, including the experts who have worked on the front line of Wuhan. They may be doctors and nurses. Since June the 24th, in 4 districts of Beijing, including Xicheng and Haidian, we have taken samples with 377 experts from our hospital. We have completed 53,000 samples, and at the maximum, we have taken over 10,000 samples per day. To further boost our capacity of nucleic acid testing, within 58 hours, our hospital has built some green channels according to the safety requirements. With those laboratories, they have over 630 square meters in area. And we have very clear routes in the laboratories. For example, we have a specific section for the sample preparation and a specific section for the testing. So according to the National Health Commission and the Beijing Municipal People's Government's arrangement, about 21 experts and 66 experts have worked on 4 shifts for daily testing. So we have increased our capacity of sampling from about 4,000 to 10,000 per day. And with informatization technologies, we have improved efficiency of testing. On June the 17th, we can handle a large number of nucleic acid testing. With professionals, we have our small applet in place. We recommend those patients to complete their payment, sampling, and taking result on the same applet. So if they have taken the test on the same day, they could get the result on that day. And as to the results, we have submitted them to the Beijing municipal platform through the Jiankang system. The patients or the civilians could check the result of their testing. In the future, our hospital will continue the regular measures for prevention and control of epidemic. We always put the top priority to the safety and health of the general public to improve our medical service quality and contribute to the resumption of our daily lives and to the work in Beijing. Thank you, Mr. Wen Ming. Now let's open the floor to the journalists for more questions and answers, and please identify yourself before you raise the question. Thank you. In the middle section and the 6th row, please. Thank you. From Beijing Youth. My question is to Mr. Wu Zunyou. For the different levels of risks in Beijing, what are the criteria and what's the significance of the division of different risk levels? Thank you for your question. As to the division of 3 risk levels, we have 3 criteria. Firstly, about the regional difference. For example, we take the units of neighborhood and community and township. The second dimension is about the time, which means the 14 days of the coronavirus is the criteria. And thirdly, the number of cases and any collective outbreak of the cases. So those are the 3 standards for the division of risk levels. To put it in details, in one community, within the 14 days, we check if there is any case of coronavirus and how many of those cases. Then we can determine which risk level this neighborhood belongs to. Of course, we have to take consideration about the changes of the epidemic situation in order to adjust the risk level. For example, now we have only 1 high-risk area and 18 belongs to the intermediate risk. In this way, we can have precise measures and scientific policies to timely control the spreading of the coronavirus, and at the same time, the civilians in those neighborhoods will not be severely impacted. With the division of risk level, we could minimize the consequences caused by the coronavirus. We tried our best to guarantee timely and effective and scientific control of the epidemic transmission with the risk division so that the general public's daily lives will not be impacted heavily. We want to minimize the impact. Thank you. Last question, please, in the midsection and 3rd row. Thank you. From CMG. As we know, Beijing will report the districts of the newly added cases. So is that based on the cases last place of activity or other standards? So we will give the question to Mr. Wu Zunyou. Thank you for the question. As to the management of infectious disease, we have a specific law of infectious disease, and according to the law, we have the so-called local jurisdiction of the virus. So what does it mean? Is that locality referring to the residing place of the patients or the hospitalization place of that case? For example, if they live and seek the hospital in the same district, then there is no conflict. But if he lives in a different district from the hospital he or she went into, then there may be difference. How shall we decide? And the answer is, it's based on the hospital that he or she goes to. And we also have to register the residence of that patient and report the information to that neighborhood. The most important thing is that we have to take records about the activities of that patient and his or her close contacts. Then we will do our investigation and follow-ups of all the close contacts to guarantee no spreading of the virus. So we need smooth communication between the two players. Thank you. This is the end of the Q&A session. The press conference is broadcasted by Beijing People's Government and its Sino blog, Tianlong website, Shoudu Zhichuang, the Xinjing newspaper, Beijing News, Beijing Toutiao, Jingjing FM, Beijing's Time, People's Daily, Beijing Channel, and People.com News Agency.com, and CCTV Financial Channel, China's Daily Sino blog, and China.com. Beijing Transportation Radio and Beijing News Radio will also show this press conference. Beijing TV will live broadcast this show as well. So thank you all media friends and all our staff members. This is the end of today's press conference. Thank you.